Good morning, everybody. I'm Muriel Bowser. I'm the mayor of Washington, D.C., and we are in the John A. Wilson building. Today, I'm providing a briefing on vaccine distribution in the district. I am joined by the chairman of the council, Phil Mendelson, the city administrator for the district, Kevin Donahue, Director LaQuandra Nesbitt, who is the director of DC Health, Dr. Louis Farabee, who is the chancellor of DC Public Schools, Lindsay Maxwell, the director of the DC Office of Labor Relations and Collective Bargaining. I am also joined by members of DC government who represent our employees. I first want to acknowledge Deanna Forrester of the Metro Washington Labor Council, as well as Corey Upchurch representing AFGE, and President Hollingsworth of AFSCME, Andre Phillips of NAGE, and President Lyons of the Washington Teachers Union. So I want to thank them for their presence today, but more than that, for their partnerships with us throughout our response to the pandemic. While we're talking about vaccines and vaccine status moving forward, I do want to acknowledge that our labor representatives here represent people who have been responding to this pandemic throughout since March 20. 40% of them have been responding every single day in person every day of the pandemic. We have slowly brought DC government workers back throughout, and probably in February, we had members of the WTU, AFSCME, all reporting to schools to make sure our children could get back in the buildings. We've also had our police and firefighters and corrections officers reporting every single day in person. And on July 11th, the whole government went back in person and are working the majority of their work weeks serving DC residents. So I want to thank our labor leaders. We would not have been able to do all of those things without DC government workers. It's been very, very important to me, too, that we take these next steps together on how ensure that everyone gets vaccinated. We know that we have been very steadfast and successful in crushing this virus in the district, and now we're going to do the same with the Delta variant. The way to do it, however, is to get everybody vaccinated, and we are going to do our part as well in DC government. Before we talk about the requirements for DC government employees, I want to Dr. Nesbitt to give you an update about our experience with the virus. But Chairman Mendelson, would you like to make any remarks? And Chairman Mendelson will be here if there are further questions. Thank you, Dr. Nesbitt.
Thank you, Madam Mayor. In the District of Columbia, we continue to see an increase in the number of cases of COVID-19 in our population. We know some things about that population. We know that we're seeing an increase in the 5 to 14-year-olds compared to last year. They now represent 1 out of 10 of our new cases. And we know that for that age group, the 12, 13, and 14-year-olds in that age group who have the ability to be vaccinated, that our vaccination rates for our Black students in that age group is much lower than our vaccination rates for white students and Hispanic or Latino students. What's driving our increase in cases right now is really that 25 to 34-year-old population. And we don't see any meaningful disparities in terms of who are those new cases from a race and ethnicity perspective. From a race perspective. Blacks and whites in that age group seem to be equally represented at this point. We also see, however, a huge gap in vaccine coverage for that age group. With Black residents in that age group having half the rate of coverage as their white counterparts. And Latino or Latinx residents have a great vaccine coverage rate in that age group when compared to Blacks and white residents. It's also important to note that we see cases, the majority of our cases, since the vaccines became available, are occurring in people who are not vaccinated. While similar to other jurisdictions, we are now seeing some increase in breakthrough cases over the past month. But the vaccine is indeed still working. Since vaccines became available, out of all of the hospitalizations of DC residents, about 1% or 2% of those hospitalizations were in people who are fully vaccinated. We see a little bit of an uptick there, but again, more than around 90% of the people who are in the hospital are not vaccinated. So it's extremely important that we continue to offer all of the tools and resources to people to encourage and require vaccination where appropriate so that we can together crush this virus. For folks who are concerned about breakthrough infections and whether or not vaccines are still worth it, they are absolutely worth it. We are all better off as a community when we have more people in our community who are vaccinated. We are also going to do a better job once everybody gets vaccinated in helping to prevent more of these variants from taking over our communities. So I am extremely happy to be here with the mayor today and thank her for her leadership. We know that we can get in a better place in the District of Columbia because we've been there before, and we look forward to all of our residents who are unvaccinated making the wise choice to move forward and get their COVID-19 vaccine. Thank you, Madam Mayor.
Thank you, Dr. Nesbitt. So once again, you can check coronavirus.dc.gov to follow our experience with the virus, including daily reports of cases. And as I mentioned, I want to talk a little bit more now, and I'm likely will turn to Kevin Donahue and Lindsay Maxwell to talk about specifics, especially for your questions. But we have worked with our labor partners who represent a good number of our 37,000 employees on a requirement for a COVID-19 vaccine to further government efficiency and certainly as a component of our own internal security and protocols. All employees, contractors, interns, and grantees of the government of the District of Columbia will be required to be fully vaccinated against COVID-19. Full COVID vaccination will be required for all new hires appointed to job vacancies posted on or after August 14th, 2021. All covered individuals have until September 19th to be fully vaccinated. We will, of course, have a process for people who want to apply for exemptions. And any unvaccinated employee, even those who qualify for the medical or religious exemption, will be required to conduct a weekly COVID-19 test. And failure to comply will lead to adverse employment actions. We have been reporting for a number of weeks our experience with our workers. We have asked them to report their status. And to date, 59% of our employees have reported their status. And of those reports, 54% of the people who work for DC government, we know, are fully vaccinated. Dr. Nesbitt already talked some about our vaccination numbers. We know where we are with 12-year-olds and older. We have about 74% of those young people have had are either partially or fully vaccinated. And for 18 plus through 64, I guess that is, 75% of people are partially or fully vaccinated. And of the 65-year-olds and older, over 87% are partially or fully vaccinated. We've also talked, and we need to talk a lot more, and communities need to talk so that our young people are getting vaccinated. We know that kids who are 12 years old and older qualify for the vaccine, and it's so, so important that they go out and get it. Anacostia High School, Ida B. Wells Middle School, and Dorothy Height Library are sites supported by the government for the vaccine. Kids qualify for giveaways and gift cards, and DC Public Schools has also sponsored a big vaccine and health screening day as well. So please follow us at coronavirus.dc.gov or go to DCPS's website for information about what you need, not just for the COVID-19 vaccine, but for all of the health requirements to start school. I've already talked about the youth who can participate in the incentive programs, including $51 gift cards, AirPods, iPads, and a $25,000 chance. A chance to get a $25,000 scholarship. So please, young people, teachers, administrators, let your families know as well that this information is out there and that getting young people vaccinated is going to be able to protect everybody at the school. Incentives for youth 12 and 17 are provided on site as well at Brooklyn, Sousa, and Johnson Middle Schools. These sites operate Tuesday through Thursday, 11 to 7, and Saturday, 10 to 4. Additionally, you can still get tested, and we want to remind people a lot of the reminders that we gave early in the spring. If you need a test, get a test. Familiarize yourself again with the symptoms for COVID and make sure if you're feeling sick that you stay home. Residents, workers, and visitors can access free COVID testing daily. And we also have seen increased interest in our at-home testing kits. I really want to thank DC Health for being forward-thinking and having these test kits provided. They're at the libraries, and the turnaround time for your own test is pretty fast. So we want to remind you to get tested. I also, sadly, we have a reminder in our own community, a friend of ours, Chucky Thompson, legendary musician from DC Public Schools graduate, I think, Dunbar. He died over the weekend related to COVID. So COVID is not over. Chucky was 53 years old. Any questions? Yes.
I imagine. With the testing requirements for employees, it says weekly it will be required. Is that going to be provided by the government, or will they be, having to go get their tests on their own?
Sure. And Kevin, if I can have you go through the details of the program.
Thank you. So for employees who are choosing to submit to weekly testing and provide a negative test, district government will provide self-test kits at work locations where there's a meaningful number of DC workers focused on schools, police stations, fire stations, and some of the larger municipal buildings. If it's impractical based on a work site to provide a self-test kit, a supervisor will work directly with their employee to identify a manner and way in which that employee can get tested without having an impact on the operations of city government.
Yes, ma'am. Clarify, if you're a current employee and you do not want the vaccine and do not have a religious or health exemption, you can still stay employed providing you get weekly testing.
Weekly testing and provide a negative test result.
And can you talk me through your decision-making process? Why not just say a mandate, say everyone needs to get vaccinated unless you have these two exemptions?
I'll start this. So the goal is to get everyone vaccinated. We know that keeps people safe. There is an opportunity working with our employees and their unions to be able to boost our vaccine numbers much higher than they are now. I believe without getting to the point where we have to impose a mandate as a condition of employment on everyone. Much of our discussion with the labor partners behind me, with Lindsay Maxwell, has been both talking about the requirements we're here announcing, but also plans to really have a lot of public education campaign around vaccinations that is management and union working together. I think this is a chance to boost our numbers. There's also another element in one of the data points that the mayor mentioned, which is we know we have 54% of our employees have registered their vaccination. 40 have not registered their status at all. So we know there's people who are vaccinated, but we don't know their status yet. So until we have a much clearer idea of whether it's 54%, whether it's 80%, we'll be able to have a much better gauge as to how to boost it to 100%. If we conclude, based on our experience, that what we have in place now is not sufficient for keeping our residents safe, then we'll engage with unions, we'll engage with employees about what adjustments to make to our policies. But it's important that we work in partnership, and I think we can boost our numbers much higher with the track that we're on right now. For both vaccinated and unvaccinated individuals, by the time we get to September 19th, there'll be an electronic way for individuals who are vaccinated to upload their vaccine cards, and those who are not to provide their negative test results. For those in which that's not practical to do that, we'll be working over the next 5 weeks with employees, with their supervisors, for effective ways to be able to provide that evidence without impacting operations.
So it's on the employee to upload their negative test.
Employees working with their supervisors to be able to provide the negative test results. The employees will get the test results themselves as private citizens, so we'll be working when it's electronically, preferably, when that's not feasible, for more rudimentary ways for people to provide their test results. And there's a lot of examples around the region and the country who have an almost identical model to the one we're laying out for doing that. That ranges from uploads to an IT system to simple drop boxes that people provide their negative test results into.
Yes, sir.
The mask requirements for those people who are not going to be vaccinated, it says in the, I don't know if this is a mayor's order, but whatever the legalese is, says that there will also be a mask requirement for people who are not vaccinated. And I'm wondering if that extends to outdoors. Will DC government employees who are not vaccinated be required to wear a mask all the time when they're working, just when they're interacting?
I think our current order applies to masking inside. Is that right? Yep.
Inside, regardless of vaccine status, and outside when you're having a close interaction with a member of the public.
Okay, so can we just clarify that, because I think this is kind of where people are going to see a problem. So does that mean when and I know DC Fire has been pretty much doing this all along, but so does that mean when DC Police interact with the public outside, or a DPW leaf collector or a ticket writer are interacting with other employees or the public, that they have to wear a mask?
When they're spending a meaningful amount of time within 6 feet of the member of the public. So it's not sort of just a passing interaction or a distant interaction. It's very close proximity for a meaningful amount of time.
In fact, I just want to drill down this. So if we're talking about a work crew, a DPW crew, 110-degree temperature, laying asphalt on the street, they're in close proximity to one another, will that crew be required to wear a mask? Or the one, or if any of those individuals are unvaccinated, be required to wear a mask? In this
those are interactions that we'd have directly with individual work groups. And the reason I'm answering it that way is there may be conditions, given the variety of work that we do in DC government, in which there might be a legitimate health or safety issue, let's say for oppressive heat and wearing a mask. So if we make an adjustment, we'll do so interacting with sort of the unique circumstances of a particular team.
Mayor Bowser, can I ask you, and I've talked to business owners yesterday, Vita Fitness, who's implemented their own requirement, and they're calling on you to go further than just requiring this for government employees, but just to do something like New York has done, and to see a vaccine passport or a vaccine mandate for everyone in the city if they want to go into indoor events, if they want to go and socialize at theaters, restaurants, government buildings. Why have you not taken that step?
I'm not sure how effective that will be on a jurisdiction by jurisdiction basis, Mark. We don't live in bubbles, and we certainly don't live in a bubble in this region or even on the East Coast. We support businesses having rules for access to their buildings and their services, including masks, of course, which is a mandate in the district inside, and vaccines. Any other questions? Okay.
Can I ask if you've watched the video of the police officer punching the gentleman the other day, and just your thoughts on what you saw? We've heard from Chief Conte, your thoughts on what you saw, and can you respond to, there's a lot of people who are saying, look, this guy did have a loaded weapon in his waistband, and these guns, you and Chief Conte have talked endlessly about the need to get these guns off the street, and here are police trying to do that. Obviously, perhaps went too far in their use of force.
Perhaps.
But, I'm just trying to walk a fine line here and ask.
Yes. So let me respond to your question first. Yes, I did view the video, and yes, I was briefed in detail by Chief Conte, and I support the statements that he's made, and I also understand the frustration that people feel. First, we saw one of our police officers sworn with a gun and a badge appear to use excessive force in punching somebody. The chief was very clear. Our officers aren't trained to do that in order to take a gun. So I want to be clear about that. We also want to be clear that all of our officers have a responsibility to each other and to the community. So all officers have a duty to respond. I want to be clear about that. I also want to be clear that MPD has a presence in a community, and I know that community very well, where there's open air drug dealing. Everybody knows it, and everybody wants something done about it. So our officers will be present, will be responding, we will be going after guns, and we will protect people's constitutional rights. Yes.
Mayor, a follow-up to that question.
Yep.
You have been very vocal, the chief as well, about making sure that gun offenders are being held accountable and not re-released into the streets. We
Yep.
have a situation here where the man who was punched in the face was charged with firearm possession, and then we learned that that case was released. Is this not exactly what you were talking about in that situation? Do you feel he should have been charged?
I do feel like he should have been charged. But I also know the reality that the prosecutor probably said to himself, I'll take this to the jury. There's no way it's going to be prosecuted, so I might as well, spend my time on something else. The whole thing is completely frustrating. At least we got the gun, and we've identified somebody who maybe will take advantage of some help to choose a different path. Yes, ma'am.
Do you have any more information on what the safety protocols will be? In the spring, vaccinated individuals did not have to quarantine if they were exposed in a classroom. Will that be the same this year? Will there be different quarantine rules for vaccinated and unvaccinated individuals?
Chancellor Fairby.
Thank you, Perry, for that question. There will be different guidance and protocols for quarantining for this school year. The CDC recently released guidance on definition for close contact in a K-12 setting. On last Friday, the Department of Health issued further guidance in alignment with that. DCPS is currently converting that to policies that schools will follow for this current school year.
And so what are you using as a definition of close contact?
So the CDC and the DC Health guidance indicates that anyone that's within 6 feet in certain settings, such as pre-K or adult education, and then 3 feet for traditional K-12, for 15 minutes or more would be a close contact. But there are exceptions when there are mitigating strategies in place, such as form-fitting masking, some of our HVAC improvements, and other strategies. So if you are in a classroom space and you're in 3 feet distance and those mitigating strategies are being implemented, the individuals that will be identified as close contacts will not need to quarantine. If they're unmasked or those strategies are not being implemented, then those individuals would need to quarantine.
So with the disparate vaccine rates that we know are happening among our youth between, Black, white, and Hispanic 12 to 17-year-olds. Do you fear that unvaccinated students will be in classrooms for fewer days because of rules than vaccinated students?
Well, first of all, we're thrilled to partner with the mayor, the council, and DC Health to get the word out about the importance of the vaccines and to get everyone vaccinated before school starts. You heard today about the incentives that we have at schools. We're encouraging families to go out to Sousa, Johnson, or Brookland Middle Schools, in addition to the other sites we offer. We know that given the current guidance that we have from the CDC, we will not be in the posture we were in last year, where we would potentially have to quarantine an entire class. So we anticipate the impact for quarantine will be less significant than it was last year, which will allow us to maximize in-person learning, which is where we want our students to be. And so we want families to understand that our doors will be open on August 30th, and we expect to have all of our students present in person, full-time, 5 days a week. And if there's a need to quarantine, we'll provide instructional materials and support the students accordingly.
Thank you.
Chancellor Farabee, for students who have to quarantine, will they be allowed the option of distance learning at home? And at what point would you decide to have a student learn asynchronously or tune in via simulcasting?
So that would depend on the magnitude, the number of students that would be quarantined, and then the duration. If it's a minimum number of students being impacted, we don't anticipate having the need to implement simulcast learning where there's synchronous learning for the remote student. However, if there are significant numbers, we will utilize that tool, but it would be on a temporary basis. Any student that would have daily access to remote learning that's synchronous would need to complete the medical exemption.
What would be the difference between a significant and a minimal number?
Yeah, so we're currently, great question, we're currently in those discussions right now with the Washington Teachers Union. We want to ensure that we define that together, but I would anticipate if half the class is quarantining, that would be a significant number.
Mayor Bowser, will you require a vaccine mandate for charter school staff?
Charter schools aren't DC government employees. Yes, but I would.
And along those lines, Mayor, just to clarify, does today's order apply that all teachers will have to be, public school teachers will have to be non-charter vaccinated by September 19th? I just want to clarify. Is that what that means?
Or, Kevin, can you just, we went over it already, but.
All DC government employees, contractors and grantees who do direct service will by September 19th either have to show full vaccination status or agree to show a negative test result on a weekly basis.
But that teachers are included in that?
Yes, teachers and all school staff are included in that,
Okay.
as well as contractors that come into schools to do direct service work with students.
And I had a separate question for the mayor and also Chair Mendelson. We had another violent weekend in the district, and 3 people dead, including a 69-year-old man from Suitland who had spent his life growing up in D.C. I know there was a disagreement between you and the council as far as money for police officers, violence interrupters. What do you want to see happen from here?
With the council?
In general.
Well, we want to see all the strategies on the ground and working. We want to see all parts of our criminal justice system in person and working. We want to work hand in hand with the community to identify and work with people who need services before they commit a crime. And the bottom line is we're going into this fiscal year in a much better situation in terms of our resources than we did last year. We will have, with this the budget the council approved, the ability to hire almost 200 new officers and more police cadets. Last year, when we were going into the new year, we couldn't hire any new officers. We're also going into it being able to work with a plethora of programs and services related to getting people in more job training, in additional pathways slots, and putting intense resources and grants on our building blocks.
Thank you. I want to emphasize the last point that the mayor made, which is that there are a number of different strategies that the council and the mayor are together on with regard to reducing crime and reducing violent crime. Folks like to focus on the fact that the council and the mayor didn't agree on the exact number of police officers, but if you think about it, what the council did this year was agree to increase the number of police officers, to hire more police officers, which is quite different than a year ago. And the council also supported a variety of programs and additional funding for a variety of programs to reduce violence. I want to emphasize that I think really the two branches are on the same page here. We don't like the violence, and we want to reduce the violence, and there are a number of different strategies to do that.
Following up to that, Mayor Bowser, last week you said when you put a measure forward, you get it done. The council did not approve your request for 170 new officers. Are you going to sign the bill then?
That's if you misunderstood what I said. What I said, Stephanie, was if I make a proposal, I fund the proposal, and that's what I did. The council, of course, can accept it or not accept it. I intend to sign the budget. It is, you don't get every, or have I already signed it? Did I already sign it? I may have already. I'm going to sign it. Let's put it that way. It probably has 99% of the things that we need to get done. And we're going to keep working with the council. Just in a few months, we're going to start working on the next budget. So we'll keep at it.
If I may. A colleague of mine did some reporting yesterday looking at the school districts and the number of staff that were vaccinated or at least reported vaccinated within the districts. I say around 43% that did report for DC public schools. Apparently only 39% of that, or 39% of that 43 reported being vaccinated. That number is less than 50. Is there any explanation as to why that number is reported less than half? And do you see that number going up for parents who might be concerned about, who's vaccinated and who's not moving forward, even though the new requirement was just put in place?
So I'm not sure I'm tracking your numbers, but as shared earlier, similar to other government employees, we've asked for voluntary reporting of vaccination status. Of the individuals that have reported for DC public schools, 90% of our employees have indicated they're vaccinated. So as the city administrator mentioned today, this is a step forward in allowing us to gather more information from all of our employees, determine who is vaccinated and which individuals would need to provide a weekly negative test.
Just to clarify, charter school teachers are grantees, so they are required under this?
They're not grantees.
They're not? Okay, so they are not eligible. And is there going to be any testing for vaccinated employees in schools or elsewhere?
We don't anticipate testing for vaccinated employees.
Just two quick questions. One, answer, but for maybe Dr. Nesbitt, we're hearing from DC residents who were vaccinated out of state for whatever reason that they're having trouble migrating their vaccination data into DC's system. Have you heard this, Dr. Nesbitt, and how can they?
We've always discussed that, and I'll re-emphasize the mayor's point. That's the problem with the suggestion that you would have a vaccine passport or a requirement for vaccination mandated by the government at the city level for access to services, events, activities out in the community. We know, and we have always known, and our website indicates that we have a substantial number of DC residents who have received doses of the COVID-19 vaccine outside of the district government or from a federal entity that may or may not be within DC's city limits. Because of those things, we have been able to work with many of those entities to get aggregate level data, but we often lack the identifying information that is necessary for us to validate the resident status in our immunization information system. It is incumbent upon the jurisdictions to share data with each other. That sharing is better with some jurisdictions than others. And if they don't share that record with us through an electronic exchange, and I can't validate that you were vaccinated in Florida, even though you're a DC resident. I can't validate that you were vaccinated in the Virgin Islands if you're a DC resident. You'll have to make sure that you have your card. The card has always been an acceptable form of showing proof. of vaccination, and we'll continue to do that. You have a question?
Yeah, I'm just wondering, for any of the unions, what are they hearing from their membership as far as why they're not getting vaccinated? And do they think this will actually work to increase the number of DC employees who are vaccinated?
Who wants to go?
I figured it'd be me. So I'm Deanna Forster, the president of the Metro Washington Labor Council, so oversee the unions in the District of Columbia and the metropolitan area in Maryland. I mean, I think that what we all realize is that many of our, working people are people of color, and they come from a place where they don't trust the government. We've done a lot with the support of the Bowser administration and the chancellor to try to educate our members. We've done town halls, we've done worksite vaccination clinics, but I think, the fear is very real, and we look forward to continuing to work through the process to help get our members there. We also have lost leaders in the labor movement from COVID, and I think that's hit home for a number of us. So we want to make sure that we're doing everything that we can to protect our community.
Good morning, everyone. I'm Jacqueline Pogue Lyons. I'm the president of the Washington Teachers Union. I want to thank the mayor and the chancellor and Chairman Mendelson for inviting us here today. We've heard word from our parent organization, which is the American Federation of Teachers, which has told us that up to 90% of our members are vaccinated. It's just coordinating together to get it reported. I think our DC public school teachers have done an extraordinary job rising to the occasion of teaching virtually, but they know that many of our students have suffered over this last year and a half while having to teach virtually. Our members are ready to go back in person. They want to be there. We are hopeful that along with working with the chancellor and the city that we'll get our memorandum of agreement signed. We know that our teachers work with students who will not have the benefit of the vaccine. So they want to keep them safe, and they're going to do whatever they have to do to keep them safe, which means if they don't vaccinate, they have to test. And we know that we have to work out the details of what that is, but we are fully encouraging people to get vaccinated, and we are also working with the District of Columbia and the Chancellor in order to get our families to buy into the vaccination. And we're also happy to announce that we received a grant, again, from our parent organization, the American Federation of Teachers. It's a $77,000 grant, not only to encourage vaccinations, but also to support families in getting their routine immunizations. We know that over the last year and a half, that has fallen to the wayside. And we're also encouraging families to come back and feel safe. So we're working with the community, we're working with the chancellor, we're working with DCPS because we're ready to get back in person.
Yay. All right.
Nothing else to say after that.